Well, good afternoon, and thank you all for, for joining us this afternoon. I'm John Rolfe, and I'm President and CEO of the Wichita Regional Chamber of Commerce. And again, it's a privilege for us to welcome you to the Childcare Tax Credits webinar. I'd like to begin and certainly say thank you to our co-sponsors. Those three are Workforce Alliance of South Central Kansas, the Regional Economic Area Partnership, and the Greater Wichita Partnership. Now, I know I personally can relate, and I know many of you can also relate as well to the importance of childcare. I know as a parent of two young ladies, they're now in their in college and in high school. But not only was it great to have parents and other family members to assist, but there were times that we needed great childcare from other providers. And so this is certainly a critical issue to everyone, whether you're an employer, whether you have children, or whether you manage people who do have children. It's all critical to us and to the success of our efforts in creating that economic impact with our companies in this region. It's important to the Chamber also because it's one of our legislative agendas, but it also is a policy that supports quality, safe, and affordable childcare, which has always been a part of our agenda, and not only just for the Chamber, but also for the partners that are on this webinar. I want to share with you the individuals who will speak this afternoon. We'll have Tanya Bullock, who's the Executive Director of Child Start. We also have Becky Tuttle, Council Member for District 2, Nathaniel Blank with Watkins Public Strategies, and Michelle Mulwitty, the attorney who specializes in employment law with Martin Pringle, Attorneys at Law. Following these presentations, we are going to take questions. However, I want to make sure you're aware we will not be giving legal advice. We would recommend that you, in fact, consult your own legal consultant for specific questions about how the child care tax credits may benefit your business. This webinar will be recorded, I should say is being recorded, and will be posted to the Chamber's website later this week, along with other resources that you can discuss that will be discussed during this presentation. So with that, I'd like to turn it over to Tanya, and if you would please get us started.
Thank you so much, John. Very excited to be here today. Right quick, I'm just going to introduce myself as Tanya Bullock, the Executive Director at Child Start. We're a local nonprofit organization that focuses on early learning for lifelong success. So we work with licensed childcare providers, potential providers, families, and community partners so we can ensure the quality of care for our children in our community. I'm going to kick it off with the video and then we'll go from there.
All of us know childcare is an ongoing issue that impacts workers and affects hiring decisions.
I have two little girls. 9 years ago, I was able to find childcare quickly. With this one, I thought, I'm going to find childcare quickly again. I did not. All of them were full. So then I had to go back to my employer and tell them, I can't find childcare. Is there any way that you can be flexible with my work schedule? And they said, unfortunately, because of your rule, you have to be in the office 8 to 5. So I had to make a decision, which really was made up for me because I didn't have childcare and I had to quit my job.
I lived in Wichita for about 3 years. And when we first got here, we were on a wait list. We were on that wait list for 18 months. I had to commute kind of across the city to get to daycare and then back across the city to get to work every morning. And then on top of that, our daycare is open from 7:30 to 5:30. So that makes commuting kind of hard because you have to drop off and get to work very quickly in 30 minutes and the same when you get off work.
30 to 40% of my paycheck is gonna have to go into childcare.
Yeah, so we're a single income family. And I probably pay 40% on daycare.
Childcare mostly surfaces itself in a couple of ways. Being able to accept one of our entry-level roles and give the career they want a go, or work-life balance and the flexibility we have to find in order to accommodate someone who wants to manage their child's quality of life as much as their own at work.
Our ability to attract talent does have an effect with childcare. We have lost several to childcare challenges before and after COVID. Childcare becomes an issue with our employees when they become promotable. And so we have to be creative in how we arrange their work, and we don't want childcare to be something that is a barrier to their promotion.
I think employers need to look at focusing on how to lower those obstacles and those barriers of entry. And they might need to think more radically than they've had in the last, 20 or 30 years. And what that means for childcare is we might need to see childcare being supported by our private businesses.
I do wish employers were a little bit more flexible, because I'm in a position in my life where my husband's the sole provider now, and we can do that, we can afford that. But what about all the other parents that can't?
If more employers provided childcare at their physical location, but also if more employers included childcare in their benefits packages, that would be so helpful.
I think to improve access to childcare for employers, it's important for us to know what tools and services are available in the community that we can hook our employees up with, and so that they have an opportunity to make some choices and feel like they have some choices for childcare.
Not every employer understands their role and how to support that. There could be work done on increasing that awareness.
We are working alongside communities to tackle the lack of quality, affordable childcare. One way to achieve this is we've developed an approach where we connect communities with perspectives, ideas, information, and resources.
One example is the Childcare Tax Credit here in the state of Kansas, which was recently expanded. Over the years, it has been terribly underutilized.
For example, only 100,000 of the 3 million tax credit was claimed in Kansas. Whether you're a large corporation or a small business, if you're providing childcare for your employees or even helping them pay for childcare with a licensed provider, you may be eligible for this tax credit.
So it's important to get it right, to get childcare right, to make sure those opportunities are there, access is there, not only for the child, but for the institution responsible for taking care of that child.
Perfect. So back in early 2022, a group of community members, business owners, nonprofits, government officials, i.e. Becky, who's on this call, we came together to discuss our childcare crisis, not just in our community locally, but also across the state. And as we worked through all of the possibilities and the ways that we can have impact on this crisis, that's when we learned about that childcare tax credit being underutilized. So the video showed only 100,000 out of the 3 million was being utilized. So that's what really got us thinking and talking about what we could do. We knew we have a problem. It wasn't just childcare, though. It flowed into our workforce, which in turn overflows into our economic development. And all of these go hand in hand. And we realized we couldn't do this alone. So we looked at the data across the state of Kansas. We realized across the entire state, we are only meeting 44% of the demand for children under the age of 6 who are potentially needing childcare. So that's roughly 85,000 children under the age of 6 who may or may not be with or without childcare. In turn, their parents aren't returning or even beginning the process of working. So when we compared it to Sedgwick County, where we were having this meeting, we realized we weren't meeting but only 41% of the demand here locally. So roughly 16,500 children out of those 85,000 were right here in our local community, and they were needing access to quality, affordable childcare. When we're thinking about affordable childcare, the average cost for an infant in Sedgwick County is $1,250 a month. It goes down as the child gets older. So our 3 to 4-year-olds are ranging around $800 a month. So we heard those parents in the video talking about how much they were spending, and that's likely true for everyone else, even across the state. They're looking at spending 40% or higher out of their paychecks on childcare. The other crisis with that is infant and toddler care is already really scarce, but now it's also expensive. So when a parent's looking for childcare, they're looking to meet their specific needs when they're trying to find that right program for their family. So our goal during this process was to raise awareness among employers on the challenges that many workers are already facing when it comes to accessing quality, affordable childcare. In doing so, we started to share solutions and tools available to help the employees, their workers, the owners, but also includes partnering up and opportunities to connect with local childcare providers, as well as other strategies that businesses can do to really get their workers invested and really understanding what's going on. So we developed the strategy for this video, which we're very proud of. It really helps tell the story the impact is having with childcare and employment directly, but it's directly from the employers and the parents. And that was what was really important to us, is that Keith Long and I didn't just go around sharing all of the problems, but you actually heard the problems straight from the mouth of the babes. Once this video was created, the Workforce Alliance and Child Start started to utilize the video during presentations like the one today. We are trying to get into chambers of commerce, SHRM chapters, any leaders across, we even went out of Sedgwick County a few times. And we want to really get these folks to help us lead in spreading the word, not just about the crisis, but the underutilized tax credit and the other opportunities they can utilize. So it really kicked off this conversation that Keith likes to say, and now I've adopted it, but we're done admiring the problem. We're taking action now. We're empowering businesses and providers to take advantage of the tools and the resources that are currently available. So in November, we were hoping to really start spreading the word about the possibilities of everything that currently existed and what you could do to get invested in this initiative. We threw out the idea of the tax credit, obviously. Can you provide an FSA, a flexible spending account, to help parents save for childcare? Are you in the position to create an on-site childcare at your place of business? Can you offer parental leave? Because studies show that when you're able to offer parental leave, parents more likely to remain in the job if they have the opportunity to stay at home with their newborn in those early months. And then when they return to work, can you institute an infants at work policy? So these were great ideas that happened behind the scene. Then as we got into the room with employers and providers, and we started having real discussions, we realized that these aren't always the most feasible options for everyone to take advantage of. This isn't a one-size-fits-all solution for everyone. So example, you're a manufacturing company. You're probably not going to be able to bring your infant to work. You may be a business who wants to create an on-site early care and education center, but are you prepared to run it? You have the money maybe to build it, but you aren't prepared for what comes with running it. So really, we needed to get with employers and providers to figure out how to individualize and pivot in ways that made sense for their businesses. And we have made some progress. We've learned about programs in the community who are doing some out-of-the-box ideas, and others who are absolutely willing have come out of the woodworks that we didn't even know existed and are excited about this opportunity and trying to figure out how they can work on this. So what we've created is an opportunity for childcare providers to connect directly and face-to-face with an employer, where they can kind of to share about themselves. What are they willing to do? What are they able to do? What maybe have they been excited about doing and never had this opportunity and have been waiting for this partnership with an employer so they can work to increase that quality, affordable childcare and get our parents back to work with maybe just a little bit less stress. So we've heard quite a bit from people in the community and developing solutions to even creating a family-friendly workplace. One idea that we heard was an employer is willing to pay to hold a childcare seat with a potential new provider. So essentially, this could be a hiring incentive. If you partner up with a quality program and you both match up and everything's great, you can pay that provider to hold a spot. And when you have a new employee interested, you can say, don't worry, we have a spot covered and here it is. We know there's an 18-month to 2-year wait list for infants. So if you have somebody who just had a baby and is ready to get back to work but hasn't found quality childcare program that meets their needs, you may be able to help them. On the flip side, the provider said the same thing. They are willing to partner with a business who will do this with them and for them. And this is vital because we need them communicating, we need them connecting, and we need them making the decisions that are best for both of their programs and the children and families that they're serving. We also heard from McConnell Air Force Base, who they're doing something a little unique. They implemented an idea where a program where you essentially sublease your childcare spot. So it gives an opportunity for short-term childcare solutions through the use of an app. It's similar to an Airbnb. The app opens up, you see where there's a spot open, maybe the child is on vacation, and that parent says, you can have my spot for the week or two while we're on vacation. So that was kind of something unique that we heard. McConnell also has partnered with family child care providers, both on and off base. If you're offering care for a military child, they're giving stipends for that. And I know that's one of the things we discussed with some employers. Would you be willing to give a stipend as part of your benefits package? And we've heard from a lot of employers who are willing to do that. So we know this isn't one size fits all. We know this is not going to happen overnight. We can't repair this, but it is something that we can all work together on. And we just all need to know that there are ideas, there are solutions, there are resources, and there are so many people available to help address and hopefully fix this crisis. It may not affect you directly, but I guarantee it affects someone you know, whether they're a parent, a provider, an employer, and just sharing this message and letting them know that there is a community of people invested in early care and education solutions, I know we'll make progress. So we do recommend, if you're an employer, that you do complete a family-friendly workplace survey. I will put the information in the chat after this, but it will help you truly learn where your current staff's needs are and how you should really proceed based on those results. The Workforce Alliance and ChildStart both created websites where you'll find supplemental materials, resources, and contact information where you can connect one-on-one with either Keith and I, and then we can help get you connected with a provider and a business. So this is my time, it's up now, but I want to thank everybody for being here today because it really truly means a lot to me to know that there's so many people willing to learn more about how we can potentially work together to be a part of the solution. I'm going to introduce now Nathaniel Blank with Watkins Public Strategies, and he's going to let us know what's happening out in Topeka.
Hello, thank you, Tanya. Glad to see such a healthy turnout for such a very important topic today. I am Nathaniel Blank with Watkins Public Strategies, and I'm pleased to be able to share some information on the legislative activity related to addressing the issue of childcare affordability and availability. So there are two pieces of legislation that I'll be talking about today. So the first is Senate Bill 164. This bill actually has a hearing scheduled for tomorrow morning at 9:30 in the Senate Tax Committee. And if you'd like to view that hearing, you can go to YouTube and just search KS Legislature. And then under the live tab, there will be a section for the Senate Tax Committee. So what Senate Bill 164 would do is provides a $2,000 non-refundable income tax credit to any Kansas resident that takes a job as a qualified employee of a licensed childcare facility. The employee would be required to work a minimum of 900 hours in order to qualify for the tax credit. And again, the credit is non-refundable and it cannot be carried forward to another tax year. So just some quick definitions that are in the bill. So a child care center means a facility that provides care and educational activities for 13 or more children, 2 weeks to 16 years of age, for more than 3 hours and less than 24 hours per day. And that includes daytime, evening, and nighttime care. and also includes before and after school care for school age children. And then a child care facility includes child care centers, daycare homes, group daycare homes, and preschools as well. And a daycare home means a premise on which there is a maximum of 10 children under the age of 16. A group daycare home is a premise in which there's a maximum of 12 children under 16. And a preschool simply means, provides learning experiences for children who have not attained the age of eligibility to enter kindergarten. So really the purpose of the bill is to attract more people to take jobs in childcare. And this would not only bring those individuals that would receive the tax credit into the workforce, but then that also provides more opportunities for people who are not able to enter the workforce due to a lack of childcare to then also find a job and be able to join our workforce, which we are so desperately in need of help with. So the other bill that is being drafted has not yet been introduced, but it is intended to lessen overburdensome regulations in order to make it easier to get workers in this field, while also it will increase the number of children a childcare facility would be able to serve. The legislation really approaches this issue by cutting red tape. Kansas is one of the strictest states in the union when it comes to childcare ratios. So for example, only 3 states have a 3-to-1 ratio requirement for infants. Kansas is one of those, and Maryland and Massachusetts are the other 2. Most other states have 4 to 6 infant per adult ratios. So really, this is a pretty large bill, and there's a lot to unpack. Fortunately, I don't have time to go through all of it in this short webinar, so I'm just going to hit the highlights for us today. And there will be a detailed breakdown of the bill and a state comparison sent out to all the attendees via email. So with that, really the bill covers ratio requirements, as I talked about briefly, staff requirements in terms of required training hours prior to employment. It would lower licensure fees. It removes multiple miscellaneous regulations that are just kind of, like I said, cutting through red tape and tying up our hands and getting more childcare available. And then also, importantly, preempts local government regulation of childcare. It does this by saying that cities cannot be more restrictive than state law. Wichita was even more restrictive than state law just until a week ago when they adopted Councilmember Tuttle's proposal to remove that and match state regulations. And so if we can get that for all of our cities across the state, we can really try to make an effort in allowing more childcare to open up. So again, there is no date scheduled for the hearing on this ratio and regulation bill yet, but we have been in contact with leadership and have been told that a hearing is forthcoming. This bill is really just a multi-pronged approach to try and get us to the standards that other states have already been using and having success with, because we would be hearing by now, a lot of states have had these standards in place for a good while, and they've been successful with them. And we'd be hearing right now if there was any great issues with those. So we're just trying to get Kansas on a level playing field and open up our childcare support. So with that, I'll be happy to answer any questions at the end. And after that, I'll pass this on to our next presenter. Thank you.
Thank you. I'm Becky Tuttle, and it is my privilege and honor to serve as City Council member representing District 2, which is the northeast portion of our community. Another great opportunity that I have is I'm a member of the Wichita Coalition for Child Abuse Prevention. Many may not know this, but I started my career as a school counselor years and years ago. And so this is something that I'm very passionate about. And I joined the workforce work group, the child care work group. And I did that because of also my background in public health. The #1 predictor of adult health, adult incarceration, and high school graduation rates is 3rd grade literacy. So the quicker and more prepared we can get our kiddos to go to pre-K and kindergarten, the more successful their life outcomes will be. And so I was certainly the novice on this work group learning about childcare and early learning, but I heard the group say that the city of Wichita had an ordinance that was more restrictive than the state. And so I started doing some investigation. We have a childcare licensing division here within the city of Wichita. No one really could tell me why our ordinance was more restrictive. No one at the state could tell me why. None of the childcare providers or advocates. So I came back to our Metropolitan Area Planning Department and our legal department, and I found that the original ordinance was passed in September 25th of 2009 and truly hadn't been revisited since. And so I did some more investigation. One of the things that I did that I found just to be a really heartwarming experience is I went with our childcare licensing team team. And I did ride-alongs for home childcare inspections and also for center inspections, and learned how incredibly complicated this entire system is to become a home or center childcare provider, but then also how dedicated these professionals, and I say that they truly are professionals, are to providing quality, affordable, reliable childcare. And so navigated through the process of getting our ordinance truly, as Nathan mentioned, just up to what the state is. We want it to be in line with state, but we were absolutely concerned, and I was absolutely concerned that safety of the children is paramount. That has to be the number one thing. And so we knew that within the city of Wichita, if we were able to just pass what the state has, with the state already being more restrictive than most of the nation, that this would be a good opportunity for the city. Right now, within the city of Wichita, we regulate 299 home childcare facilities. And if every one of those home childcare providers can have 2 more kiddos, that means that we're going to have about 600 more spaces if everybody chose to bring more kids on. The other thing that I'm hopeful for is for economic development, that not only is this an opportunity to bring people back into the workforce who maybe are limited because they can't find safe, reliable, affordable childcare, but then maybe more small business entrepreneurs will become childcare providers. I had the opportunity to meet a couple of weeks ago with a 23-year-old woman who just started her own childcare, and she's a small business owner. She's an entrepreneur right here in Wichita, and I hope she'll be a role model for others. So we were able to pass the ordinance last Tuesday on February 21st. I'm very excited to say, happy to champion that. And the next step is, because this is actually a zoning change, which doesn't make a lot of sense for folks, but it is according to our regulations regarding number of employees and parking, and it gets really complicated, as I mentioned. But the next phase will go to the Sedgwick County Board of County Commissioners. That will happen in March. I've already coordinated with all of my colleagues at the county and made sure that they have all of their questions answered. So we anticipate that it'll pass there. And then when that case does happen, each home care provider will be able to have 2 more kiddos. So again, I'm happy to champion this, and now working with some folks at the state legislature, anything I can to be supportive. But I see this, and I say this all the time, this is an economic development, and this is a workforce issue. Whether or not you have children who are in the age of child care or not, if you're an employer, if you supervise people, where we live, learn, earn, play, and pray, this is an issue. And this is one of the first steps that we can address it, just raising the awareness of the issue in our community. So thank you for the opportunity to be here today. Thank you for the opportunity to serve you. And I look forward to continuing to work on this initiative. And with that, I'll turn it over to the next speaker, who I think is the content expert, really, for sure, why everybody's probably here, Michelle. But have a wonderful day.
Thank you so much, Becky. And thank you everyone for joining us this afternoon. I have to tell you, not only am I a lawyer, but I'm also a mom. And I know that about 10 years ago, when I had my daughter and was looking for childcare, I found myself in the position of having to tell daycare providers before I told my own family that I was pregnant, because I knew that the wait would be so long to find infant care. And in fact, I got my daughter on a waiting list in October, months and months before she was born. And it wasn't until the following October that there was a spot available for her. And I know that I am not the only person who finds myself in that position, and that there are countless other women across Sedgwick County and the state who find themselves in similar positions. And oftentimes they are left having to make really difficult choices. Choices that impact their family and their career trajectory. And so it's not a secret that this is a bit of a passion project for me as well. And I happen to be a participant in the last Leadership Wichita class through the Chamber. And during Economic Development Day, someone mentioned this child daycare tax credit. And I said, why haven't I heard about that? There is a pot of $3 million out there, and I don't know anything about it. And if I don't know anything about it, who else doesn't know about this as a resource? And I realized that Child Start was involved in advocating for the use of this tax credit. And so I reached out to my friends at Child Start to see how I could help. And that's what brought me here today. So Tanya, thank you. And thank you for to the chamber for this opportunity to speak to you. You know, as an employment law attorney, I have been hearing from so many other businesses who are struggling to find workers as we are in the midst of this labor shortage. And I've heard from many that they believe this is an issue, the lack of affordable childcare, that is impacting their ability to recruit and retain good talent. For me as an attorney also, I'm about the numbers. And so I'd like to just start by trying to put some of this in perspective. So I'm going to share my screen with you and some facts that I just think are important for us to all consider. So I want us to take a look at what the median family income in Sedgwick County looks like. And that is $69,832. I think it's important to note, and I've asterisked this here, that a woman's median in earnings in Sedgwick County are only $25,713, right? And so I just want all of us to come at this issue with this perspective in mind. Below that, you will see the annual price of childcare as a percentage of median income. These stats are Sedgwick County specific, and I will make sure that a link gets posted in the chat. These stats all came from the U.S. Department of Labor. And there are wonderful maps on there. You can take a look at county by county within the state of Kansas to draw this data out. But you'll see that the price of childcare as a percentage of median income, certainly during the infant phase, is the highest. It's 11.3%. And you'll see a gradual decline in the percentage of income that families are spending, right, to provide childcare. I also think it's important to note that this is the price per child. And we know that 29% of families with children under the age of 6 had 2 or more children in that age group, which means the percentage of their annual income that is taken up by childcare costs is greater. We also know, based on information that was put out by the U.S. Department of Labor, that we have 10% of families living in poverty here in Sedgwick County. And so certainly the economics of that situation can make it more challenging for them to access childcare that they can afford. I also think it's really interesting to note that in Sedgwick County, and again, this varies by counties across the state of Kansas, but in Sedgwick County, 74.5% of women are participating in the labor force. That's a great percentage of women. But I think we also can recognize that women are more often affected by childcare and either its availability or lack thereof when it comes to their participation in this labor market. And the final statistic that was significant to me as I began exploring this issue is that 12.6% of Kansas parents with children age 5 and under had to quit, not take a job, or change a job because of childcare issues. And so that number is significant to me. And I think, as we examine this issue, we need to think about changes that we as employers can make so that people are not placed in that same position and are not placed in the position of having to make those hard decisions, which ultimately impact their families, but they certainly impact economic development in our region as well. So let's talk about this tax credit, because there is $3 million sitting out there that is wholly underutilized in this state. I think Tanya shared with you that only about $100,000 of that tax credit was used or claimed. And my hope is that by providing some additional information, we can empower you as employers and businesses in our community to think creatively about how you can take advantage of this tax credit to benefit your employees and your workforce and our community as a whole. So what does that look like? Well, am I the only one that remembers the Choose Your Own Adventure books from childhood? I don't think I am. And I really view this tax credit as a bit of a choose your own adventure, right? You get to decide how you go about using it within the confines of what the statute allows. You get to think creatively about the resources and partnerships that you already enjoy within this community and how you can activate those. And you get to decide what level of risk you're willing to take, right? Which I think is important too, because the $3 million is a cap. It is first come, first serve, right? And my hope is that it's gone, right? That it all gets utilized. And there's a long line of individuals waiting. But I understand that there may be some individuals out there who say, boy, I'm willing to take a look at this, but what if the credit's gone by the time I get in line? Well, choose how much risk you're willing to take, right? I think when we look at the overall cost of employee benefits, though, you'll be able to come to a number that makes sense for you and your organization, where you can really maximize benefit for your workforce. So what can you use this tax credit for? Well, this provides a tax credit if during the taxable year, the taxpayer pays for child daycare services for its employees or locates child daycare services for its employees, or if you provide facilities and the necessary equipment for a child daycare service for your employees, or if you provide access to available child daycare services for your employees. So let's break that down and look at each one of these. The first one that we talk about is a taxpayer who pays for or locates child daycare services for its employees. This provides for a 30% of the net amount spent by the taxpayer during the tax year for those child daycare services. They have to be purchased in Kansas, and it has to provide for your employees' children, right? Their dependents, to enjoy these child daycare services. They have to be with a licensed daycare provider in the state of Kansas. And the credit is capped at $30,000 per year. So what might that look like? You know, perhaps you could consider implementing a policy where you provide X number of dollars of child care payments per employee over a period of time, right? That might be what that looks like. Perhaps you help locate child daycare services, right? You partner with another organization that can help locate those as well. It might look like that too. So again, 30% of the net spend with a cap of $30,000 for that one. The other opportunity is for you as a taxpayer to actually provide the facilities and the necessary equipment for the child daycare services. So you are establishing a child daycare, right? If you do that during the initial year, the tax credit provides for 50% of the amount spent, but capped at $45,000. You can do this as an individual taxpayer or in conjunction with other taxpayers. So you can partner with others to provide these services. Again, it has to be established in the state of Kansas, and it needs to be primarily for the use of your employees. When I say primarily for use by your employees, you will be asked when you fill out the Schedule K-56, which would need to be completed to claim the tax credit. You'll be asked the number of your employees' dependents who received services there, and the number of non-employee dependents who receive services at the daycare facility. And so those things will have to be tracked throughout the year. But again, for this one, it's 50% of the amount spent, capped at $45,000 per year. Then, you know, the tax credit recognizes that you're going to continue to operate that daycare facility, hopefully into the future. And so it provides a 30% tax credit capped at $30,000 for those operating expenses. Now, the same rules still apply. It needs to be in Kansas. It needs to be primarily for the benefit of your employees. And once again, there's an expectation that you're going to be tracking the number of your employees cared for at that daycare facility and the number of non-employee dependents cared for at that facility. The final category that we have here is 50% of the amount the taxpayer pays to an organization providing access to available childcare services. And so for this to apply, again, we're looking at things that are happening within the state of Kansas. And it needs to be primarily, once again, for the benefit of the taxpayers' employees. So 50% of the net spend, capped at $45,000. You've heard me say the net spend a couple of times as part of this. So certainly, you know, if you decide that you're going to provide a facility and the necessary equipment, and you're actually going to operate a facility, I think everyone understands that there may be a cost, tuition, right, for a child to attend there. And so, you know, your net spend is going to be less whatever amounts employees are paying to you. Hopefully that makes sense to everyone. So again, you know, these are all options or opportunities that are available under the tax credit. There are lots of different ways to take advantage of this. As I said, you really do get to choose your own adventure, right? You can decide which of these makes the most sense for you and for your employees, and figure out the best way to utilize the tax credit. I've highlighted a few things down here that I just think are important to keep in mind. Again, the money has to be spent in Kansas. You know, so if you have employees in multiple states, in order to claim the credit, you've got to be spending the money within the state. The child daycare facility or provider must be licensed, and you will have to complete a Schedule K-6. As I was visiting with some folks earlier, I mentioned that if you go and Google K-6, Schedule K-6, the first thing that pops up is Oxycontin. Just scroll past that and you'll find the Kansas Department of Revenue, and you'll find access to the Schedule K-6. In completing a Schedule K-6, you will have to complete one of these for each child daycare provider that's referenced. Okay. And which means if you have employees who are utilizing a lot of different daycare facilities across the area, you're going to have to complete more than one of these because you're making payments to more than one, right? And there's certain information that you're going to need to provide on the schedule. You're going to need to know the name of the facility. You'll need to know the license or registration number of the facility. And again, depending on whether you're the one operating or establishing it, you'll need to keep track of those ratios of employees but versus non-employees. But you'll certainly want to know, well, how many of our employees are utilizing each facility that we're claiming on the schedule. The form itself, though, I think is pretty straightforward and self-explanatory. It is only 2 pages with instructions, and I think we've all seen schedules that are much more involved and complicated than that. If you're interested, I'd encourage you just to pull down a copy of the schedule and take a look at it. But I think you'll find the information there useful. Finally, if you're looking at taking advantage of this tax credit, I would encourage you to develop a written policy that's specific to your organization, outlining, how does an employee qualify under your program? What are the expectations? What information do you need them to provide to you? And setting out how you intend to implement this within your organization. Because your employees are going to want information too, and you're going to want a way to tout this benefit. And the best way to do that is to reduce it to writing so you're in a position to distribute it to your employees and explain it to them. That is a very quick rundown of how this works. I think that we have some questions within the chat, and I'm going to turn this back over to Tony, who could help us moderate this. And certainly, I want the other panelists to chime in as these questions are asked. Thank you, Tony.
Thank you, Michelle, and thank you to all of today's presenters. I'm Tony Porter, Vice President of Government Relations at the Wichita Regional Chamber. So we're now, as Michelle said, going to move on to the question and answer segment. If you have questions and you've not yet already entered them, you can put them at the bottom part of your screen into the Q&A or this chat section. So let's go to our first question. Are these credits specific to employers, or can these be used for individuals who are looking to open a new child care facility? Michelle, do you want to start with that?
Sure. So originally when the tax credit was established, and this has been around for a number of years, it was limited to C Corps. Those were the only entities that could take advantage of this tax credit. And the legislature got together and they said, well, people aren't taking advantage of this. Let's expand its applicability. And so now it is more broadly applicable. So certainly partnerships and LLCs could take advantage of this as well. So, it's no longer just strictly limited to C Corps.
Does anybody else, Tanya, anyone have anything to add?
I do, thank you. I'll just add, for someone who's looking at opening a new childcare facility, there are grants out there right now to assist with this, especially if you have a partnership in your local community. They are grants to help increase childcare slots and capacity specifically, which opening a new childcare facility would indeed do. So if you need that information, you can find some of that at Child Start or reach out to us too.
Thank you. We'll move on to the next question. If employer 1 and employer 2 partnered to establish a child care center for their employees, could each employer claim the $45,000 tax credit, or would they have to split the credit? Michelle, I will give that to you to answer, please. Thank you.
Well, I think that I don't have a definitive answer to that question. I haven't looked at that one specifically. Obviously, it is contemplated, though, that organizations can partner and establish in conjunction with one another. And if you look at the schedule K56, it's looking at the spend by that taxpayer, right? Less amounts that they receive from any other person who's contributing, right? So, I think that you'd have to use the formula. You'd have to look at how much each individual taxpayer is contributing to the establishment of a daycare facility. But the cap is per taxpayer. It's not per facility.
Understood. Thank you. Anybody else have something to add? All right, we'll move on to our next question. Is this credit available for companies that do not have their headquarters in Kansas, or is it for anyone who has any kind of office in the state, regardless of if they are headquartered in the state?
I should stop muting myself, Tony.
You're good. Thank you.
I feel very unhelpful, but that's why we brought her.
You're all terrific.
So this is available to anyone who is subject to Kansas income tax, right? And so, you don't necessarily have to be headquartered here. If you are operating a business and are taxed within the state and are a Kansas taxpayer, then this is available to you.
Thank you. Anybody else? All right, the next question. How would this tax credit help an existing facility if we wanted to expand or build another facility?
Well, I think that, this contemplates the establishment of a facility that would be utilized by you to provide care for your employees' dependents. And so you may need more than one facility to accomplish that objective. And I'm not reading here any limitation that would preclude you from utilizing this to open another facility. I think it's just important to keep in mind that the cap would still apply. $45,000 for the establishment and $30,000 for the operation. And that's not per facility, it's per taxpayer.
Thank you. Okay, the next question, how would this tax credit work if a few large employers band together to establish a new facility?
Well, I think that's pretty similar to the question before about one or more organizations partnering to do that. Again, I'd encourage you to look at the schedule, the K56, to look at the way that the schedule contemplates doing the math, right, to come to that number. But the tax credit, again, is per taxpayer. And you once again just have to look at whether the facility is primarily for the benefit of that taxpayer's employees.
Thank you. If a business offers payments for childcare to its employees, is that taxable income to the employee? I don't think that we have any CPAs on the call, but if anybody has a way to weigh in, otherwise we recommend contacting your tax professional. Okay. Would the tax credit flow through to the partners and shareholders of the S Corp?
So again, they contemplate that, and it really depends on whether you're set up as a pass-through or not. But if you pull up the schedule, it contemplates that on there and gives instructions for how you should consider and make that calculation as well.
And we have one final question. This one might be for Nathaniel or Councilmember Tuttle. How can we as businesses advocate for changes and regulations related to childcare? Would you, Council Member?
Yep, Council.
Just Becky. It's always just Becky. You know, I can say from being on the work group with folks and from working closely with the chamber and the workforce center of South Central Kansas and with Child Start and other child care advocates, and I consider myself now to be a child care advocate. I wear that badge proudly, that we were intentional. We had a proclamation first for Child Care Awareness Day. I have taken steps within my colleagues so that they understand this. Before I was on council, I was an advocate in the community for issues that really matter to me, most of them focused around health and public health. And I learned quickly that no one cares or understands your issue as much as you do. And so I really feel that as our council members, our commissioners, our state legislators learn more about this and they hear the stories and they hear the data, because some people make decisions with their heart and some with their head, that's how we're going to get people interested and engaged. But really the first part is just raising the awareness. I think this is a silent crisis that not enough folks are talking about. And I'm just really proud to be able to champion it anyway. If there's stories that can be told, if there's interviews that can be done, anywhere I'm going, I'm trying to talk about this issue. And I'm trying very hard to remind people it's not a woman's issue. It's not just a family issue. This is a workforce development and economic development issue. And that I think also brings it to the forefront. So thank you for the opportunity to respond. And Nathaniel's much brighter than I am. I'm sure he'll have better response. Thank you very much.
Councilmember, you've summed it up extremely well. Yeah, I mean, really just be involved. That's why these issues are finally starting to be addressed, is because we've had enough people come forward with their stories and how these issues are keeping them out of the workforce. And that's how these things get attention. So, showing up to your city council, writing your legislators, and if you're even so inclined to testify on behalf of the bill up in Topeka, anyone's welcome to do that. And so really just, being engaged in being active and looking for solutions for the problem. And if you have a solution, bringing it forward. That's how these things get worked out. And that's how we draw attention to these issues. So thank you.
Thank you both very much. I'd again like to thank all of our panelists and participants for taking part in today's webinar. Please watch your inbox for an email that will direct you to the Chamber's website, where you'll have access to a recording of today's webinar, as well as access to the resources referenced by today's presenters. On behalf of the Chamber and our partners, thank you for your interest and participation in today's webinar.